Hi there! Welcome to the Doctor Teacher, where we never stop learning. I am Mustafa Dönmez, internist, occupational health doctor, and a teacher. And this episode's topic is delirium, and specifically the causes for delirium, because it's such a broad topic, it's not possible to talk about everything within the next 10 minutes. So I will predominantly talk about the causes of delirium. Now, every doctor will encounter a delirious patient at some point. So it is also important to know what is delirium. So let's get to it. Delirium is an acute confusional state. It is an organically caused decline in mental functioning that develops, and this is important, over a short period of time, typically hours to days. And then there are disturbances in attention, consciousness, and in thinking. So, although the symptoms are neuropsychiatric, the causes are usually elsewhere, as we call it somatic. So, in a patient who is delirious, to treat them well, you need to find the cause of the delirium. And there are so many possible causes. So it can be helpful to have a system to start with, a shortcut, if you will, to search for the causes. And one that has helped me throughout my medical career has been a very helpful mnemonic named DELIRIUMS. And in DELIRIUMS, every letter of delirium stands for a cause that might cause the delirious state. Easy enough, right? So trust me, it is simple and very practical. So let's get to it. The first letter is D for drugs. Well, usually, especially elderly patients have a long list of medication, and these can interact with each other and worsen possible side effects, and also invoke a delirious state. So it is important to, in every delirious patient, to at least go through the medication list and look after a medication that has recently been started, but also medication which has been stopped. Some medication you can't stop cold turkey. So the first one, and one of the most common ones, is the D of drugs. The next is the E from emotional state. And that's one at least I forgot in the early process, because an emotional state, especially in an elderly patient, can have a very, very high impact on how they're functioning. If a patient is afraid because they're in a new environment, or if they've just lost someone, that can give anxiety, and those are very, very strong states that can cause a delirious state. The next one is the L of low oxygen. So whatever the cause of a low oxygen or low sats in your system, in your blood, whatever the cause of that is, that can cause a delirious state, because your brain needs oxygen to function, right? So if you have a pneumonia, if you have congestive heart failure, if you have pulmonary embolism, all of those can cause a low oxygen value, which can cause a delirious state. The next one is with drugs. One of the most common reasons of a delirious state is the I of infections. It speaks for itself. If your body is in a stress situation due to an infection, whether it's a urinary tract infection, again, a pneumonia, for example, whatever the case, that will cause or can cause a delirious state. The next one is something you might forget. It's retention, especially urinary retention. Urinary bladder retention is also one of the reasons for a delirious state, especially in elderly patients again. The next I is again one that elderly patients have a high risk for, namely ischemia. So whether it's cardiac ischemia or it's cerebrovascular accident. Whatever the case, the eye of ischemia is also a possible cause of delirious state. The next one is also one you don't easily think of, the U of undernutrition. So if patients cannot drink enough or eat enough, or they have an intake that has been low for a longer period of time, think of a patient who has dementia, who just forgets to eat. That can cause a delirious state above the dimension in this case. And the next one is the M of metabolic state. The friend of every internist. Think sodium disturbances, think glucose disturbances, whatever the case, the metabolic state is usually one that you can find with lab tests. And finally, the S of subdural hematoma. If there is a bleeding in your skull or in your brain, that can absolutely cause a delirious state again. So there you have it, deliriums, with the use of this mnemonic acronym, how you name it, doesn't matter. If you go through these letters, I guarantee you that a large proportion of delirious patients, you will find the cause. Is it complete? Definitely not. There are more causes of a delirious state, but it is a good starting point, and it is a way to have a system to look at the causes of a delirious state. So there you have it. Did you find them helpful? Or do you have another shortcut or acronym or mnemonic that you use? Or what is your experience with delirious patients? Leave a comment. So the more the merrier again. Subscribe to our channel, The Doctor Teacher. We will come back to you with diverse medical and non-medical topics. I'll see you next time.